Next comes hemodialysis. So hemodialysis and ESRD services, this is being done only for patients who suffer from renal disorders, especially the end-stage renal diseases, right? So here we have specific codes for dialysis, whether it is hemodialysis or peritoneal dialysis, you need to figure it out. Now coming to this ESRD services, here the services are rendered for a calendar month, that's for a month's time, and you should know the age of the patient, what is the age of this patient, and secondly, what is the number of visits that are being done. Is it a single visit or is it like 2 to 3 visits or more than 3 visits? Accordingly, our codes differ. Okay, and sometimes if it's going to be a home ESRD service, you can select the code for that also. Next, we see small amount of tests that are done under this domain of gastroenterology. Here we have gastric motility studies, esophageal motility studies, or the manometric studies, and the entire GA imaging. So we have very specific codes. We also have something like capsule endoscopy. Here what happens is a patient is asked to swallow medicine, which is like that of a capsule. It's just like a medicine. And what happened, this capsule will have a camera and a recorder. So it records the entire images and which can be taken as a report, and then finally it is excreted naturally. So here sometimes you might also have the code sets in the category 2 and 3 sections of the CPT manual, especially in the category 3. Right, the emerging technology. So don't always assume that the code should only be in the category 1 of the CPT manual, because when similar procedures can also be found in the category 3, which could be more specific than the category 1. In that case, you need to assign the appropriate code. Sometimes if you see this code 911110, if you see this code, it says GI imaging intraluminal capsule endoscopy, esophagus through ileum with interpretation and report. So here you can see modifier 52 if ileum is not visualized. So you will have to report such modifiers too. Okay, just see the instruction that is being given underneath so that you can report it. You don't have to know a thorough understanding of what a GI imaging or a endoscopy is all about, but these technical terms would help you to figure out the code.